3 patients contracted HIV from a cosmetic procedure. Here's what I want to tell you. If you don't know me, my name is Dr. Joy Moy. I'm a doctor of acupuncture integrated medicine here in New York. My practice focuses on 2 things and 2 things only: pain-related conditions like neck pain, back pain, shoulder pain, and cosmetic procedures such as microneedling, radiofrequency microneedling, and microcurrent. Here's what happens in a med spa in New Mexico that you need to be aware of. Last week, for the first time, the CDC has reported that HIV was transmitted to patients undergoing a vampire facial. So here's what happened. 2018, it started where a woman allegedly acquired HIV through this unlicensed med spa. Since then, 2 more patients, so now for a total of 3 patients acquired HIV at this unlicensed med spa performing the vampire facial. So if you're not familiar with the vampire facials, I'll tell you in a nutshell what it is. If you haven't seen the vampire facials perform on any celebrity or anything like that, here's what it is. Vampire facials, you take blood from the actual patient who's going to get the facial, you spin it in a centrifuge, you separate the blood, the plasma, the platelets, and you take that PRP, platelet-rich plasma, and then you put it on the face, inject it using a disposable one-time use cartridge. This is for a microneedling pen, and this is for a radiofrequency microneedling device. As you can see, these are sealed, one-time use only for the patient. Not one patient, not one per patient, one-time use only. So apparently this spa allegedly was reusing either the cartridges and or the blood vials to collect on patient. So let it be known, I do not perform the PRP, the vampire facials on my patients. What I do perform on them is microneedling. So what I do for my patients, I show them the cartridge that I'm going to use on them. I show them it is unopened, okay? And even my patients, they say, oh no, Dr. Joy, it's okay, you don't have to show me. I trust you. No. It's not a matter of trust. It's me doing the right thing for you, so you have peace of mind that I'm doing the right thing. I don't care where you go. Me, somebody else. Number one, make sure that that practitioner who's going to work on you is licensed and trained to perform the procedure that you're going to get. So if you're going to get a vampire facial, make sure they're licensed, certified, and trained to do that. How do you know? Well, first you're going to ask. You could also go look on state boards. It may take you a few minutes, 15, 20 minutes, but it's worth your time to check, okay? Number 2, do your due diligence. Ask for patients, ask around. Word of mouth is very powerful, but also too, ask to see the cartridges. What do you use? What's your equipment, right? You want to see, and any reputable provider will show you what they use and how they go about it. I had a consult yesterday. It ran a little long. It was definitely more than a typical 20-minute consult, but she wanted to know things, and I said, you know what? I'll take the time. If you could wait here for 5 minutes while I'll get another patient set up, no problem. I'll come back and I'll explain some more. And she appreciated that. I have no problems explaining everything I do step by step. So show people what you use. If you're a provider and you follow me, you're an acupuncturist or a dermatologist or whatever, show the patients, hey, this is what it is. Now, I know some facilities, they prepare everything in advance. So your cartridge sometimes is already on the device waiting for you to show up. That's fine, but what I prefer to do for peace of mind, for myself, for the patient, I always show them, here is your unopened cartridge. I open it up in front of them, place it on the device, rest of the device nearby so they can see there's no switcheroo, nothing going on. This is your single one-time use only cartridge, okay? So stay safe out there. Do your due diligence. You're your own best advocate. Remember that. Take care.